Hey everyone, welcome back to Decode Healthcare with Harshal. I'm your host, and today we're diving straight into part 4 of our CPC exam series, Medical Suffixes and Roots.
But hey, before we jump in, make sure to like, share, and subscribe to Decode Healthcare with Harshal. Seriously, it helps these explainers reach more aspiring coders just like you. So, our goal today? We are cracking the code on medical terminology. We want to completely eliminate that exhausting rote memorization so you can save some precious time on that grueling 4-hour exam.
Okay, so how do we do this? Well, we use something called the categorical building blocks method. It's basically a strategy to translate scary medical terms into plain English. And the absolute secret to this? We actually start at the tail end of the word. Yeah, we look at the suffix first. The suffix is your anchor. It instantly tells you the exact type of clinical concept you're dealing with. Like, is it a condition, a procedure, maybe a symptom? The suffix gives the whole game away.
So let's rip through our first set of symptom suffixes. You really want to think of these as the what is happening part of the word. If you see algia or dynia, boom, you immediately know the patient is in pain. Think neuralgia for nerve pain. What if you see plegia? Well, now we're talking about paralysis, a total loss of movement. And rhea, that's just a discharge or abnormal flow, like diarrhea.
Now this brilliantly illustrates the power of contrast. Check out ragija or regia. That literally means a bursting forth, like excessive heavy bleeding. Think hemorrhage. Now contrast that violent flow with stasis. Stasis means stopping, controlling, hitting the brakes. Hemostasis is the stopping of blood flow. Knowing these opposites? Total lifesaver on the exam.
All right, let's see how this builds with our field and formation endings. These basically act as structural categories for your medical specialties and procedures. So ology is a study of a field, like cardiology. Genesis is the origin or formation of something, carcinogenesis, right? Then you have plasia, which is all about cellular growth or formation, like the excessive growth you see in hyperplasia. Oh, and Tommy? That simply means an incision. Easy.
Okay, we are pivoting now to the real climax of today's explainer. Word roots. Listen, if the suffix tells us what is happening, the root does the heavy lifting by telling us where. It identifies the specific organ or body system involved. It's the central subject of the whole term.
So let's do a rapid-fire checklist of these high-yield body system roots. Let's create some mental links right now. Cardio, heart. Gastro, stomach. Hepato, liver. Osteo, bone. Keep it moving. Neuro is nerve. Arthro is joint. And cephalo is brain. And myo is muscle. You really got to lock those in.
But, here is exactly where the CPC exam is going to try to trick you. Take nephro and reno. They look completely different, right? But guess what? They both mean kidney. No joke. You might see nephritis in one sentence and renal failure in the next. You need to instantly know they refer to the exact same organ. It is absolutely vital for tracking those chronic disease narratives in a patient's chart.
And we actually see the exact same pattern with the lungs. Both pulmono and pneumo translate straight to lung. So whether you're reading about pulmonary disease or pneumonia, recognizing this interchangeable pattern prevents so much unnecessary hesitation during the test. Finishing up our organ roots, we have dermato and cutaneo, which both just mean skin. This ties right back into your integumentary system coding. A dermatologist treats the skin, and a subcutaneous injection goes just below it. Same exact organ, totally different roots.
All right, let's shift gears for a second. We know the organs now, but what about the actual substances and physiological processes that flow through these anatomic systems?
You are going to see these constantly in lab reports and diagnoses. Hemo and hemato mean blood. Gluco and gluco mean sugar. Think glucose metabolism. Hydro stands for water or fluid balance, and lipo translates directly to fat or lipids. Just pair the root with its plain English substance and you're golden.
Finally, let's talk about our high-yield color roots. These are incredibly common. They show up all the time in physical exam findings, pathology language, and especially oxygenation descriptions. Honestly, knowing your colors is a massive shortcut.
Let's use some punchy word associations for these. See erythro? Think red, like an erythrocyte, which is just a red blood cell. See leuco? Think white, like a leukocyte. And if you see cyano, you better think blue. Cyanosis means a bluish discoloration, which should instantly alert you to low oxygenation issues.
Wrapping up our colors, we have melano, which associates with black or dark pigment. Think melanin or melanoma. And then xantho associates with yellow, which usually points to these yellowish lipid deposits in the tissue.
Now, the absolutely crucial takeaway here is that you do not need to memorize the entire medical dictionary. You just need to know these building blocks. Definitely grab your phone and snap a screenshot of this quick reference guide right now. It's basically your ultimate visual cheat sheet for all the common prefixes, conditions, and procedure suffixes we covered today.
So, you now have the tools to decode the foundational language of healthcare. But what happens when you're staring down some massive 20-letter medical diagnosis on a high-stakes exam? Well, join me in Part 5, where we are going to introduce the anatomy link method and practice some real-world medical term breakdowns. Until then, keep studying smart, and I'll catch you in the next explainer.